Hey, what's up, Baba?
What's appendicitis?
Oh, so look, appendicitis is pretty common in kids, right? You have the appendix, it's in the right lower quadrant of the abdomen. And the appendix is known as the vermiform appendix. It's an extension of the cecum, of the first segment of the large intestine. And sometimes you get fecal matter or poop that gets stuck in the opening to the vermiform appendix. When that happens, the bacteria tends to proliferate or grow, and it causes inflammation, and that's appendicitis. What you guys need to know about appendicitis is that you have to keep the patient NPO. Nothing by mouth, because anything that the patient takes enterally is going to cause peristalsis, it's going to cause severe pain and potential rupturing, which is, of course, the worst thing that could happen when somebody has appendicitis. People that have appendicitis, they're going to have pain in the right lower quadrant. You want to avoid placing any heat over the area, because heat's going to soften the tissues and potentiate rupturing, which will cause peritonitis. All the fecal matter will go into the peritoneum and cause a really bad infection, and the patient can die. When you have appendicitis, nurses need to know the exact location. It's called McBurney's point, which is right 2/3 between the umbilicus and the iliac crest of the pelvis. And so about 2/3 of the way from there to there, you're going to find McBurney's point. That's where you're going to be palpating and then letting go, and where you're going to have that rebound tenderness. And that's specific for people that have appendicitis. Once appendicitis is determined, it's confirmed, then we have to, of course, not press down there. And some doctors may request not to give opioid analgesics. Now, that might be counterintuitive, because you're thinking, hey, this is like the worst pain the kid's ever developed. We got to give them analgesics. The problem is, before the actual appendicitis is confirmed in diagnosis, that we have to find out to make sure it's appendicitis. And the worst that could happen is it could rupture, right? So if we give morphine, let's say morphine, and the patient's pain alleviates, that's exactly what happens when the appendix ruptures, in theory, that the pain goes away temporarily. So because of that, we want to avoid opioid analgesics until we confirm that it's actually appendicitis, and we're working on actually rectifying it. But in essence, that is appendicitis. There's a couple of other assessment things that you can do. There's something called the obturator muscle, and so there's something called the obturator sign, which is when you lay the patient flat on their back and you lift up the leg and you turn it this way and that way, right? So when you're doing that, it pulls on the muscle, and that could actually cause pain. So that's another indication that the patient has appendicitis. Another one is something called psoas sign. And psoas sign, you place the patient on a left side position, laying down, of course, and the right leg, you pull it back. That pulls on the psoas muscle. And if the patient complains of right lower quadrant discomfort, that may also potentially mean that the patient has appendicitis. And this usually requires surgical correction, an appendectomy, which could be open or laparoscopic. The patient might be on antibiotics afterwards to ensure that they don't have an infection. But in a nutshell,